Hi, my name is Dr. Lena O'Keefe, and we are going to be doing the neurological examination today. This part of the video will cover the cerebellar exam as well as gait. And we also have a few extra special tests, such as the Romberg examination. When you're doing the cerebellar exam in the upper extremities, you have two options. One is called the finger-to-nose test. And what you do is have the patient take their index finger and touch their nose, and then have them touch your finger. What's important is that you make sure the patient has to fully extend their arm when they're doing this. And then you have them touch their nose again, and you can move your finger and have them touch it again. What you're looking for is any discrepancy in the movement where they might wiggle it around and not quite or get your finger or their nose and they pass point or something like that. The other way to test the cerebellar exam in the upper extremity is called rapid alternating movements. And in that case, what you have the patients do is hold one hand out and have them flip their hand over and over as fast as they can. And then you have them do it with the alternate hand and make sure that the rhythm is about the same with both hands. In obvious deficit, one will be much slower than the other. Now we will do the lower extremity heel to shin exam. What you have the patient do is have them take their heel of one leg, start at the top of their knee, and go all the way down to their big toe, and then go back up again. And then you have them repeat this on the other side. And go back up. Perfect. The next part of the examination will include assessing the patient's gait. What you want to do is have the patient walk a total of 4 times across the room. The first time, you will have the patient walk normally across the room. Stephanie, please walk normally to the other end of the room. Coming back, I'd like you to walk tandem with one foot in front of the other. This part of the examination, again, helps you look for any cerebellar deficits. Now, could you turn around, please, and walk on just your toes? And then come back on just your heels. Perfect. This final piece of the examination is called the Romberg Test, and it's actually a sensory testing. It is not a cerebellar testing, which students often confuse or mix up. What you want the patient to do is have them stand with their feet right next to each other. And then you have them again put their arms out like they did for the pronator drift, as if they're carrying a tray of pizza. And then what you're going to do is have them close their eyes. Make sure that you're near the patient, and so if they wobble around, they do not fall while in your care. You let them do this for about 5 to 10 seconds to look for any instability. Perfect. And this concludes our cerebellar and gait examination.